good afternoon all. I am Dr. Anjali Taneja, Principal Consultant, Obstetrics Gynaecology, Cloudnine Hospital, Patparganj. Greetings to you all. So, pregnancy is a time when you are simultaneously excited and scared. Few things may be bothering you. One of them could be itching, which is very common in pregnancy. It can affect as many as 25 in 100 women who are pregnant. So, are all itching bad? What to do about it? It is definitely bothersome. So we can have various causes related to or unrelated to pregnancy. Today we'll be discussing about the pregnancy related causes only. During pregnancy, as the blood supply increases, it increases simultaneously to the skin also. So it is very common to experience mild itching. It can also occur due to dry skin, some pre-existing skin condition like eczema, or simply because the skin is stretching. You may have noticed some marks on your tummy, commonly called as stretch marks. So what are they? Medically known as stria gravidarum. They are stripes of reddish, brown, pinkish color, most noticeable on your abdomen, thigh, breast and upper arms. So why do they occur? Well, skin has collagen and elastin. The skin has two kinds of fibers, collagen and elastin. So as the tummy grows, the skin is flexible and stretchable, and it also stretches to accommodate the growing baby. But as we can imagine, in case of elastic, after it is stretched to a certain limit, it will just break. So some similar thing happens with these collagen and elastin fibers, that after getting stretched to a certain limit, the break point comes and they break, which causes these marks. They are usually not reversible, but they do fade after delivery to become pale, silvery white, and gradually fade to merge with the color actually fades to merge with the surrounding skin. Many patients come and ask कि डॉक्टर मेरे सिस्टर को बहुत स्ट्रेच मार्क्स आए थे या मेरी मदर को बहुत स्ट्रेच मार्क्स आए थे, is something similar going to happen with me? So yes, maybe, because the composition of the skin is genetic and the family can have similar composition. Also, if you are carrying twin babies or higher birth weight of the baby, so more the stretch on the skin, the more the marks. Is there anything that can be done to prevent them? Well, there is no definitive treatment or any magical cream available which can be applied, or any medicine that can be eaten to prevent them completely. But that also means there are other options available which may help. Simple measures like keeping yourself hydrated, avoiding rapid weight gain, good skin tone pre-pregnancy, so pre-pregnancy exercise. Massaging the skin also improves the blood flow. So in fact, all the creams that are being given for stretch marks, they basically help by moisturizing the skin and keeping the skin hydrated. As we can understand that the dry skin is bound to break easily as compared to a moist skin. So hydration and moisturizing the skin is important. It will also increase the blood flow to the skin to maintain its health. So as we just discussed, post delivery they usually fade away and gradually they merge with the surrounding skin. However, if required, you can discuss with your dermatologist for other kind of options available, which may include retinol cream, collagen remodeling, microdermabrasion or radiofrequency skin tightening. Coming to what is more medically important in pregnancy in terms of itching is something called as obstetric cholestasis, also called as intrahepatic cholestasis of pregnancy. So it is a condition that affects how your liver works when you are pregnant. So basically, liver is making bile acids which are stored in gallbladder, and then they are secreted into small intestine, and there they help in the digestion of fat and fat soluble vitamins. In this condition in pregnancy, that is obstetric cholestasis, this flow of bile is not happening properly and the bile gets deposited under the skin. So this flow of bile is blocked. The typical symptom is itching which typically affects the palms, the soles, the pressure areas like back, tummy, The itching can be mild to severe persistent itching. It can be so much that the patient finds it difficult to sleep. It is very distressing, maybe more towards night. Usually this condition will present towards the end of pregnancy, that is in third trimester. Sometimes it can happen early also. It disturbs sleeps. Jaundice is rare. Now itching is very common in pregnancy, as we just discussed. It can affect almost 25 women out of 100. But IHCP is not that common, and all itching are not IHCP. But because IHCP can affect your baby and you, it is important that the symptom of itch is not ignored and you must inform to your doctor. So when you inform it to your doctor, he'll examine you for any rash, because presence of rash rules out obstetric cholestasis. So it is itching without rash. And then you will be offered some blood test to diagnose. These can possibly include a liver function test and your bile acids level. Here we need to understand that some women may experience itching for days or for weeks before the tests become abnormal. So if the itching persists and no other cause is found, your liver function test and bile acids should be repeated. In case of any unusual symptom like IHCP, which has started very early in pregnancy, or the itching is persisting after delivery, then few more investigations may be done and you may need a liver specialist opinion also. So as we said, why this is medically important? Because it can affect your baby. How can it affect the baby? There is an increased chance that baby may pass meconium or poo before birth. There is an increased chance of having early birth, preterm birth, and then there are small chances that the baby may need care in neonatal care unit after birth. There is a small risk of having stillbirth also, that is the baby may die inside the womb also. However, the risk of having stillbirth will depend on your bile acids level. If the levels are between 19 to 39 micromole per liter, it is mild in nature, and in the absence of any other risk factor in your pregnancy, the risk of having stillbirth is no different from anyone who does not have ICP. If the levels at any time during pregnancy are more than 40 but less than 99, so that is between 40 to 99, the delivery needs to be planned at 38 to 39 weeks, because the risk of stillbirth increases after that. If the levels are more than 100, more than equal to 100, the risk of having stillbirth could be as high as 3 in 100 pregnancy. And in these cases, it is recommended that the delivery be planned at 35 to 36 weeks. When we are deciding when to deliver, apart from this obstetric cholestasis in pregnancy, there may be some other condition during pregnancy which may be affecting you. So the final decision is taken after taking into account all the risk factors that you may be having. Extra ultrasounds are not required for obstetric cholestasis. However, keeping good track of fetal movements is definitely recommended. So what can you do for this itching? How to treat it? Well, it usually gets better on its own after delivery. However, during pregnancy, to keep yourself comfortable, hydrate well, wear loose fitting cotton clothes. Local ointments like simple lactocalamine lotion may help. Anti-itch medicine. Then there is a medicine called as ursodeoxycholic acids. This medicine may decrease the chance of prematurity, but it does not decrease stillbirth. So after your timing of birth has been decided, the next question comes after, do I need cesarean for obstetric cholestasis? So no. Though because the baby may have passed poo in the womb, your chances of cesarean may be higher. But IHCP or obstetric cholestasis in itself is not an indication for cesarean. So after deciding the timing of delivery, you may decide for induction of labor also, depending on your case. Though the symptoms improve after birth, the liver function test and the bile acids which had risen will take time to get back to normal. So a recheck is advised at 6 weeks to see that everything has gone back to its normal, and if they are still high, you may need an opinion by the liver specialist. There is a chance that the condition can affect your future pregnancies also. So it is an important medical history and you need to take care of it. Also, it does not affect your choice of contraception. So this was all about obstetric cholestasis. Another important condition in pregnancy that can cause itching, intense itching, is PUP. The PUP is basically short form for pruritic urticarial papules and plaques of pregnancy. In this, small red bumps and hives appear in the skin in later pregnancy. So basically they'll appear and they may go after some time. These bumps, these small red bumps, they then fuse and form large patches that can be very itchy. Usually these rashes appear on tummy initially within the stretch mark. So patient will say मेरे stretch mark में बहुत खुजली हो रही है, and typically umbilicus के आसपास जो belly button है उसके surroundings में there will be an area of sparing. So after that it spreads, it can spread to thighs, buttocks, breast, and usually sparing the belly button. The condition is self-limiting and usually resolves on its own after some time and or after delivery. Aim of treatment is basically to relieve itching and soothe the skin. So local ointments or antihistaminics, anti-itch medicines can be given. Sometimes local steroids also may be given. This condition does not affect your baby. It is a benign condition. One more condition is prurigo of pregnancy. In PUP we had small red bumps. In prurigo of pregnancy there are tiny bumps that look like insect bites. They can appear almost anywhere on skin anytime in pregnancy. Again, the treatment is anti-itch medicine and local steroids, and the baby is not affected. So itching, though a very common symptom affecting almost 25% of the pregnant ladies, may not always be worrisome. But if the itching is persisting, is typically affecting your palms and sole more at night, the onset is somewhere later in pregnancy, do inform your doctor about the itching, as it can be obstetric cholestasis which can affect your baby, and you may need treatment and may need further discussion with you. So this was about itching in pregnancy. Now we are open to questions. So Kaniha asks, how can I stop itching during pregnancy? Okay, so if you are having itching in early pregnancy, it can simply be normal. You need to hydrate yourself, eat balanced diet, moisturize your skin well, wear cotton loose fitting clothes which are soft on skin, allow air to pass through. So these are some things that can be helpful to you. Oatmeal bath also helps with itching. So to prepare oatmeal bath, simply take lukewarm water and grind the normal oats that we have at home. Grind them and you can mix it with lukewarm water and try a bath with it. That also helps. Next question we have is, does wearing loose clothes and soft fabric affect the itching? Yes. See, anything that is harsh on skin, the itching is going to get worsened. So yes, if you are having itching, it is preferable that you wear cotton loose clothes which are mild on skin, and avoid any fabric conditioners or any too fancy things. Why am I itchy at night while pregnant? Well, Sandra, if you are itchy at night while pregnant, this may be cholestasis of pregnancy, and you do need to inform your doctor about it. And as we just discussed, you will be offered liver function test and serum bile acids. Sometimes itching may precede any abnormality in the chemical test. So it is not necessary that the test may come wrong every time, but if the itching is there at night, it has to be seen. What can I drink to stop itching? Water, any fluids. Basically keep yourself hydrated. Hydrated skin will respond better. If the skin is dry, it is going to itch more. So please have water. Does lactocalamine help in preventing itching? Yes, lactocalamine basically leaves the skin cooler as it evaporates. So yes, it acts as a soothing agent and does help. There are combinations of lactocalamine with camphor available that also helps. What is a natural remedy for itching? Natural remedy, again, you can have to basically moisturize your skin. You can use virgin coconut oil, you can use any moisturizer, you can use any vitamin E aloe vera creams, whatever is your preference, and cocoa butter, and keep yourself hydrated. These are the natural remedies. Can stress cause itching? Stress cannot cause itching, but if you have itching, stress can definitely worsen it. So it is good to avoid stress during pregnancy and otherwise also. What causes itching all over but no rash? So as we just said, itching without rash is typically obstetric cholestasis. Itching with rash could be pup or prurigo of pregnancy. So itching without rash is obstetric cholestasis or intrahepatic cholestasis of pregnancy, a condition which is affecting your liver during pregnancy. What are the vitamins that soothes itchy skin? No, an oral vitamin intake will not soothe the itchy skin. However, vitamin E combinations are available with very moisturizers that may or may not help. Does itching mean underlying liver kidney diseases? As we said, it is a condition which is affecting your liver, but this is not jaundice and this will recover. So it is not impacting your liver in long run. Can dehydration cause your skin to itch? Yes, dehydration can cause skin to itch because the skin becomes very dry. So hydration does make a difference. At what month does itching start in pregnancy? As many as 17 to 20 out of 100 females can complain of itching even during initial part of pregnancy, just after they get pregnancy test positive. But that itching is not obstetric cholestasis. Obstetric cholestasis will typically start in the third half. So if you divide pregnancy into 3 halves, the third half obstetric cholestasis will start. Sometimes it can start early. So if you are having significant itching, do inform your doctor. What does pregnancy itching look like? Pregnancy itching, mainly it could be simply mild itching in early pregnancy, just because you are slightly dehydrated, blood flows have increased, there are hormonal changes which are going on. Then it could be, in third part, it could be obstetric cholestasis. If it is without rash, with rash it could be pup or prurigo of pregnancy. And then there can be other dermatological causes like scabies, eczema, contact dermatitis. So what we are talking today is only pregnancy related causes. When and what and when should I be worried about itching during pregnancy? So if you are having itching which is typically more at night, starting during the later part of pregnancy, is more on your palms, soles, back, and there is no associated rash, there is no associated skin condition with it. Your skin looks fine, but still you are having itching to the point that you are just scratching it and there are scratch marks. Yes, you should be worried. What is cholestasis of pregnancy and what are the symptoms of it? I think we have just discussed that. Cholestasis of pregnancy is a condition that basically affects your liver. Liver produces bile acids. These bile acids, they are required for the digestion of fat. So after secretion from liver, the bile goes to your small intestine where it helps in digestion. But in this condition, this flow is blocked, so this bile is getting deposited under the skin, which causes a lot of itching. The symptoms are basically again itching, more at night, more in the third part of the pregnancy, more in the palms and soles, intractable itching which is just persistent and bothersome. How can we differentiate between cholestasis and normal itching? Normal itching can happen at any time of pregnancy. It will not be persistent. Maybe it has lasted for 2-3 days and then you maintained your hydration, changed the type of fabric you are wearing, and it disappeared. Obstetric cholestasis is going to stay. It will not disappear. It will be persistent itching, as we have just described the nature of itching. And then the labs, the blood tests that we get done, bile acids and LFT, they also play a role in diagnosis. What are the after effects of cholestasis and what are the causes behind it? Okay. So cholestasis, it will affect both mother and child. To the baby, it can cause passage of meconium or poo in the womb. It can cause preterm labor. Because of preterm labor and poo in the womb, the baby may need, small chances, but the baby may need neonatal care. And then there is a risk of stillbirth also. This risk is particularly there if the bile acids level are more than or equal to 100. Mother, it can affect the coagulation tendency of the mother, so that needs to be tested at the time of delivery. How do you test for cholestasis? Okay, to test for cholestasis, first of all, it's a history based diagnosis, a typical itch that we have just described, and then we get LFTs, the liver function test, and the bile acids level randomly done at any point of the day. If the levels are less than 10 and the itching is persisting, then we may need to repeat the levels weekly or after 2 weeks as your symptoms are. If the levels are between 10 to 39, it's a mild IHCP. Then 40 to 99 is the cutoff where complications start, and more than 100 is the risk where stillbirth can happen. Does baby feel itching if I itch? No, the baby does not feel the itch if you itch. Baby is nicely cushioned inside the gestational bag, then has fluid around it, so baby does not feel the itch. What are the precautions one can take for itching? Keep yourself well hydrated, eat balanced diet, exercising helps again by increasing the blood flow to the skin, moisturizing helps by keeping the skin soft and supple. So these are the few things that you can do, and of course wearing soft fabric. What is a natural remedy for extreme case of itching? Basically to moisturize and keep hydrated. For moisturizing, you can use any moisturizer, coconut oil, cocoa butter, whatever your individual preference may be. Does gestational diabetes cause itching? No, gestational diabetes has no relation to itching. It will not cause itching. Does itching in the stomach causes stretch marks? No, itching in the stomach will cause scratch marks. It will not cause stretch marks. Scratch marks are when we scratch and the mark is formed. Stretch marks are when the skin is stretching to accommodate the growing baby. The collagen and the elastin fibers, they break, which leaves a mark. That is a stretch mark. So both of them have separate causes. So itching will not cause stretch marks. So any other question? Okay, what is oatmeal bath? Okay, oatmeal bath also helps in relieving itching and soothing the skin. To prepare oatmeal bath, it can be done simply at home. The normal white oats that we have at home, just grind it in mixer grinder to a fine powder and mix it with lukewarm water and take bath with it. That also helps. That's a proven natural remedy for itching. Yeah. So I think these were the questions. Do we have any more questions? So we have more or less covered itching in pregnancy. Since we are left with some time, we can cover a few more things about skin condition in pregnancy. Few other changes that you may observe in your skin during pregnancy are some darkening around your skin. You may notice a dark line running in the middle of your tummy. That is called linea nigra, which is perfectly normal. Lot of females are not very happy with the cosmetic changes that are happening to them with the pregnancy, and they want a foolproof remedy. So it is important to realize that it is that we have to accept the body as it is. These are hormonal changes. They do go away with time, and no cream or no oil or no remedy is going to 100% foolproof prevent them. So these are simply hormonal changes. Few of you may notice some darkening around your cheeks. So for them it is important that you use a good sunscreen, which is very important, which does prevent this pigmentation. And the other changes that you may notice are slight dryness in your skin. It may increase. Some may notice a good hair growth during pregnancy, and then in postpartum period, typically after 3 months, the hair fall happens. So the hair growth that happened was because of hormones, and as the delivery happens, the hormones level come down, so the hair fall occurs. So many of the females will come back saying मेरा बहुत ज़्यादा hair fall हो रहा है, ऐसा लग रहा है सारा बाल ही हट जाएगा. So this is a non-scarring alopecia. That means nothing of that sort is going to happen, and eventually your hair will grow back. It may take 6 months to 12 months, but there is nothing really to get too worried about it. So that was about common skin conditions and skincare in pregnancy. It's a festival time. Many of us want to get our facials done or any skin treatments done, so we can talk about that also. Okay. Any skin treatment which involves chemicals is ideally postponed till you deliver, but simple facials you can get done. And similar queries we have for things like waxing. So again, which involve chemical peels or any skin treatments involving chemicals are not to be done. Simple waxing can be done. Avoid on tummy, avoid sauna and steam baths. They raise the core temperature. That may not be too good for the baby. So these are the things to be avoided. So hope you found this session useful, and thank you.